Ashley Parker, take me inside what's going on at the White House. It sounds like they're projecting the same kind of fear that everybody feels about going to work and trying to work and being at the office amidst an outbreak.
That's exactly right. There was a high level of anxiety as the first case emerged last week. That was the president's military valet. Then Vice President Pence's press secretary tested positive. There was a lot of anxiety. It is broken down in some ways, and this may sound counterintuitive, but by people's proximity to the president. And in fact, the closer aides are to the president, the safer they feel. Because if you're close to the president, even though you're potentially in the Oval Office not wearing a mask, you know, he's getting tested regularly and you are getting tested regularly. That said, there may be some false sense of security because Katie Miller, the press secretary who tested positive, as the president himself said, she had been negative, and then she was positive. That's how a virus works. You don't have it until suddenly you have it. But it is also worth noting that today the White House just sent out a memo instructing aides to basically follow the guidance the administration has been giving the public for weeks, which is wear a mask, wear a face covering. You now have the directive that these officials, if they're in public spaces, they need to be wearing masks or face coverings, not if they're sitting at their desk necessarily or in an office where they can close the door. Vice President Pence today was spotted on the White House complex not wearing a mask. There's skepticism Trump will wear a mask, but this is a directive that went out to aides and also telling them to avoid unnecessary visits to the West Wing. So there's finally a sense they're taking it a bit more seriously.
Dr. Gupta, can you weigh in, one, on the risk that these staffers face by being in such tight quarters? I worked in the West Wing. It is not spacious. It only looks that way on TV shows. And I see some signage up that's curious, that America's #1 in testing. The last chart I saw, based on per capita, had us around, I think, 18 or 19 in the world.
Nicole, I think it just depends on your definition of success right now. We're celebrating America's testing. I think we've reached 8 million tests in a country of 325 million Americans, 2% of the population, to your point. Per capita rates of testing are still pretty mediocre. I think there's two things to answer your question. Number one, with regards to mask and social distancing in the West Wing, nothing's going to change unless the president of the United States says, you know what, I believe the data and scientists, not dogma or whatever else he's listening or adhering to when he's choosing not to wear a mask in public. He's enfeebling this policy. Vice President Pence has done this so in a very high profile way at the Mayo Clinic. We know now, Berkeley scientists, computer scientists actually modeled out the effect of masks. And they found that if we wore masks, if 80 to 90% of the American population wore masks, we would have a 12-fold decrease in transmission of COVID-19. That's why Japan, which is a mask-wearing culture, isn't wrestling with COVID-19 the way we are, and they're a puddle jump from Wuhan. So it's pretty striking to me, the science on masks. It's not going to nothing's going to change unless the president says this is something we should all be doing and demonstrate that behavior. On the signage, Nicole, let's pay attention to one thing at this press briefing that I don't think we're going to hear anything about, but let's pay attention to it. What's the repeat testing that Americans should be thinking about? We're thinking right now everybody needs to get tested. But have you heard anything out of the CDC or the White House more specifically about how many times should an American get tested at what repeat cadence? You haven't heard anything about that. The press secretary is getting a test every day for the reasons that Ashley just pointed out, because you can test negative, and then positive. We aren't even talking about how many times we should be repeat testing Americans that are at risk of exposure constantly. Doctors, nurses, delivery people. That needs to be a part of the discussion. We need to hear if he starts talking about it. Hopefully he will talk about it today.
Ben Rhodes, I want to ask you about the president's seemingly unhinged attacks on President Obama. But I also want to ask you about the public sentiment, because the public seems to, for all the disinformation out there and for all the echo chambers for Donald Trump's disinformation, I think the public stands at about 70% who are more worried that we're going to go back too quickly. The public has internalized some of what Lori Jarrett was just describing to me in the last hour about the ferocity of this disease, just how sick people get when they get it. And you've got 68% of Americans not on board with the let's go back and roll roll the dice with this disease. What do you make of that?
Well, Nicole, honestly, the only way to really try to understand what Trump is doing is to look at it through the prism that all he's trying to do is serve his own political interests. And I think it's too hard for him to manage this pandemic effectively. He doesn't like to dig in to hard problems. He doesn't like to listen to the science. And so he's trying to think about his political positioning. And he's trying to show that he's the one who's trying to open up this economy again. And that way he can blame governors, particularly Democratic governors, if the economic slowdown, the depression that we seem to be entering endures. And he can also, frankly, blame them if the public health response is not adequate because he's pushing it onto them. The problem with his approach, Nicole, is that you're not going to be able to resume the economy unless people have confidence that they can go to the office, that they can go to a restaurant, that they can go shopping. And what that polling tells you is that the American people are not confident. And one of the reasons they're not is they're not able to trust that they're getting clear, precise information from their elected officials, particularly the president. They're not seeing the president model the kind of behavior that they will need to do themselves, like wearing masks if they're going back out into the workplace. It reminds me when we had H1N1, President Obama went out of his way when there were questions about the vaccine that had been developed to get himself photographed getting a shot, which was unusual for a president at that time. But President Trump is not modeling the kind of behavior that's going to be necessary for a safe opening of the economy either.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.